right, we are recording. Okay, hello, Mr. Adam Spencer.
Hi.
Alrighty, so can you describe the litigation of mandating the coverage of mental health therapeutic services such as ABA for autism by insurance companies? So your personal experience.
Well, yeah, I mean, when I've been in the field for next month, think it'll be 20 years since I started doing ABA in Florida. When I started there, I believe I don't know as much about the coverage in Florida as I did, as I proceeded into the field.
Mm-hmm.
But I believe it back then the only coverage was through Medicaid in Florida. But after I moved to North Carolina, they could access Medicaid for ABA for kids with autism, not directly. Medicaid did not cover it in North Carolina for kids with autism unless they went through a comp waiver program, and then they could access it. But it was very difficult for families to access it through that because there was usually a waiting list to even get on the waiver, and that made it very difficult. And so a lot of families traditionally, ABA's been around for a long, long time. I mean, the first studies started studying it back in the 1960s, and then the landmark studies showing how effective it could be for kids with autism came out in the 80s. But then there was kind of a lull between that study in the 80s that really kind of started the ball rolling about how effective it could be before there was really movement on coverage for it. So at first, only families that were very wealthy could afford it, because being that it's an intensive therapy, most kids with ABA are getting somewhere between 10, or the suggested amount is between 10 and 40 hours a week. And so when you're having to pay out of pocket for it, you have to have a certain amount of money in it. And I know families in the past that have had to take out a second mortgage to be able to get coverage for treatment for their child. And some families have multiple children with autism. I've worked with several families that had two siblings with autism, and I even heard of another family that had 3.
Wow.
It's it can be very difficult when you don't have that coverage. So I was in North Carolina for a couple of years while I did my master's degree. Then I was in Virginia for 3 years. In Virginia, there wasn't much coverage for Medicaid at the time, as far as I know. Really, the only coverage we found was at that time the military insurance. TRICARE started covering it. And I believe when I was getting my master's in North Carolina, they were also covering it there, but it was still very limited at that time. In Virginia and North Carolina, or nationwide actually, TRICARE would only cover the board certified behavior analyst or board certified assistant behavior analyst directly doing the therapy. They would not. They didn't have behavior technicians that they would reimburse for. So even though it was coverage, they put a cap on it of how much money was allotted. And then, so that limited the amount of service kids could access. And then also only the certified person could do the therapy. And that's kind of like basically having doctors without nurses. When there's only the doctor level, then that's going to really put a strain on the doctors when they're having to do everything. Right. Because a behavior analyst, our job, sometimes we'll do direct therapy, but our job primarily is on the doing the assessment, creating the treatment plan, and then supervising and modifying that treatment plan that's implemented by the behavior technicians. And at that time, so when I was in Virginia, that's all I did was I could only see, I believe my cap was about 5 or 6 kids I could work with, because they're just in that, and even then they were only getting 4 to 6 hours a week of therapy. because there's only so much time that you can
Right.
do as one person. Um, so then I moved back to North Carolina for 9 years. And again, when I moved back there, the only kids that could access the therapy were either wealthy and private pay, Medicaid through the waiver program, or TRICARE. And for the first year, it was still that issue where they didn't have coverage for anyone other than the certified person.
Okay.
And then soon after that, they did start covering what they called ABA tutors. And later on that transition into behavior technicians. But everybody with other kinds of insurance just didn't have coverage. Basically, insurance companies saw it as they would have several arguments. One, they would say, well, it's educational in nature, so the school should be paying for it.
Oh,
And there's an educational aspect to ABA therapy. We do teach skills, but at the same time, it is medically necessary therapy. And it's recommended by the Surgeon General and the American Academy of Pediatrics based on the decades of research and replicated peer-reviewed empirical studies. So insurance companies would then say, oh, it's experimental. And it's like,
mm,
again, it's experimental in nature because we're always doing more research on ABA to make it better and better. But at that point, I mean, there had already been, 2 decades or more of research showing how effective it could be. So that argument was really failure. So, the insurance companies would say that these things in order to not cover it, which is basically discrimination. And they were discriminating against people with autism to access the therapy. And, it wasn't right. So one thing that we did when we were in North Carolina is, as ABA providers, and we would get together with families and other people in the community to, lobby the legislature. And we would make trips to Raleigh, and make phone calls, emails, everything, to get that discrimination ended, to get a mandate saying that insurance has to cover ABA. And that eventually did become successful, but it took years to get there. Many years that lots of kids lost out on therapy during that time.
right.
And so I believe the law in North Carolina was passed in 2015. Um,
Wow.
so that was, a challenge for a lot of families. So many kids missed out on the opportunity, because the other thing about ABA is early intervention is the best, most preferred. Kids that are older can make progress, but if you can start within the first 5 years, they have are clinically shown to have a better outcomes, so that you don't get that time back. And really, since that time, we actually moved to Georgia in 2016, and they had just passed the law in Georgia as well,
Okay.
for ABA coverage. It's called Ava's Law. And it's based on a family advocating for their own kid named Ava that was unable to access care through their insurance company, and basically sued, I believe, and then eventually got legislation passed. It wouldn't have been. It's now, I believe, in 49 different states have coverage,
Wow.
49 out of 50. And a huge part of that is Autism Speaks, the national organization that, one of the biggest advocacy and research and support organizations for autism. They put a lobbyist in every state and basically went to work and organized with the people in the field and the families, and went through one by one each state, and got coverage for all these kids. But I mean, the work is not done. There's still a lot of limits on coverage. Technically, according to the mental health parity law, there shouldn't be any caps on services, but sometimes insurance companies try to put a dollar cap on how much
Oh,
service per year that a family can access the services. They
right.
also say location caps or location restrictions. saying it can't take place in a public school, which is technically also a violation of that mental health parity law, that ABA is a therapy like any other, might need to be done in certain locations. It's in there's actually been lawsuits about that as well, to be able to get that changed, because traditionally it's very difficult to get them to cover the services if you're doing work in a public school. And then also the public schools a lot of times won't let us in, so that's another challenge, because they want to either have their own, if they have their own contract with them particular ABA provider, or their own special education system, and they don't even contract with ABA. Sometimes they'll let us in sometimes for an observation, but not for like ongoing therapy usually. But we do have good relationships with a lot of those schools through the IEP process, and observing and being in part of that team, but not as much as we'd like sometimes. And we have good relationships with private schools and daycares and things like that will sometimes let us in to do the work, because that's the thing about ABA. It's needed sometimes in a clinic, sometimes at home, sometimes in any part of the community. And the other thing about ABA is it's applied behavior analysis. There's no word of autism in that, right?
Right.
The reason why it's so prevalent in autism is just because it's so shown to be the most effective therapy for autism, the most comprehensive, and the most research behind it. So there's been a big push to get it because of this huge rise in children with autism. The number of kids, the incidence of autism has just skyrocketed over the last 20 years. It's went from 1 in 1,000 or so, to 1 in 150 several years ago, to 1 in 48 was one of the last studies I've seen. Kids have autism. So there's not enough certified people to serve them in the country, and then not enough behavior technicians that are trained by those people in the country. And then also, like I said, it's not autism specific. We do train anyone to do work with kids with autism, but ABA can be done with anything, any behavior, with animals, with other people, with depression, or people with want to work on their fitness, want to work on their anxiety. Any kind of mental health condition could be addressed partially through ABA. But most insurance, again, will not cover ABA for anything except for autism. So we've made the push to get it covered for autism, but there's a long way to go to get it for everything else, for ADHD,
Right.
kids that have ODD, oppositional defiant disorder. It's a behavioral disorder in its name. Why shouldn't it be covered by ABA? Or why shouldn't ABA be covered for it? And maybe some insurance companies do cover that stuff, but from what I'm hearing, it's few and far between.
Yeah.
That for other diagnoses and other conditions, will they cover ABA? And there's still gaps as well. Sometimes in some states, certain insurances are mandated by the state to cover it, but if they're in a certain kind of plan, such as what they call ERISA plans, which are nationally traded like companies plans,
Mm-hmm.
like a Walmart or it's a self-funded plan basically, that a large company might pick. Some of those they're not required to have ABA coverage. So then the families have to advocate for their plan to get coverage. And a lot of them do cover it,
Okay.
but they're not mandated to. So sometimes families fall through the cracks and then have to work
Right.
to do that as well. So there's a long way to go, but we've come a long way.
Yeah.
Because like I was saying, in Georgia, specifically, they had just passed the law when I moved here, but Medicaid still didn't cover it until about 2.5 years ago in Georgia. So it's still very, very early on, and there's still a lot of work to do. And there's always ways that funding sources are looking to limit services, because it is very expensive service when you're doing intensive work.
Right. Okay. Wow. Well, thank you. That was you answered all the questions I wanted you to answer. Um,
Okay.
yeah, you went through it all. So that was really good. You were hitting the bullet points right on. So thank you so much. Um,
Another issue that we didn't talk about is licensure for behavior analysts. Um, most states, or some states don't have licensure for behavior analysts, so we only have to go on our national certification, and that can limit things because it can make it difficult for behavior analysts to get credentialed with insurance companies. And so that's another area that we're still working on. There's actually a law that's being or bill that's right now in the Georgia legislature to get licensure for behavior analysts, so that we can also, not only does it make it easier for us to get coverage or credentialing for insurance companies, but it also gives more protection to the families that are seeking these services, because if they're not licensed, well, the National Certification Board only has one power, which is to stop you from being certified, right? So if you were never certified, they don't have any control over you. So people can go around and, you know, um, basically practice without being certified. If usually they're not able to do that through insurance companies because they require that certification.
right,
But if a family's paying out of pocket,
right. They can.
then that family might be working with someone that's not credentialed or not
It's
certified,
scary.
and they can get away with that until the family learns better. And that's the other thing, is when you have a license, that protects the families, the consumers, the children, because if someone is engaging in malpractice, not only can they revoke that certification, but they can also be other fines and penalties added by the state. And also there's a board overseeing everybody who practice ABA in that state. So that's another area that we're still working on.
I do have a question for you. So you
Mhm.
mentioned how when advocating for like mental health care services and ABA services through health insurance, you had to do a lot of lobbying and you partnered with other like ABA specialists. So what would you say is like the first step in the legislative process for like getting mental health care services mandated and also licensure
Well, I'm
mandated?
not an expert on that. I've done some work in it, but I'm not an expert. But I mean, there's a lot to it. I mean, first, you need to bring awareness to the problem and gather, a grassroots group of people that have interest in it. So that being the families that have people affected by it, providers that want to provide the services, just other people in the community that are concerned about that issue. But ultimately, then they've got to advocate to their legislators, and by calling email campaigns and things like that. But nothing really starts moving until you get a lobbyist on board, most of the time, which costs money, and who's going to provide that money. Usually, you need to find an organization that is going to provide that money, or a group of families that pool their money to pay for that lobbyist, because you've got to get a legislator that was willing to sponsor a bill and advocate for that bill. And also, someone's got to write the bill. So a lot of times, lobbyists are the ones that write the bill, or the professional organizations will write the bill in conjunction with the lobbyist and/or sponsor of the bill. That's a congressman or congresswoman or senator. And yeah, then you've got a long process after that, in which you've got to develop a bill, you got to get a sponsor, you got to get other people on board that'll co-sign for that bill, and then you got to push it through multiple committees. And in each step of those committees, with insurance, there's going to be an insurance committee for a regulatory bill. Like license bill, there's going to be a licensing or a regulatory committee for that state. And then there's like other general committees. If there's any kind of state money that has to go into the bill, then you've got to go to a budgetary committee. If you can write a bill that is self-funded, like the board self-funds, and there's no state funds that go into it if you're trying to get licensure, or if if it's for ABA coverage or any other insurance coverage, sometimes that doesn't cost the state any money. But if it is for Medicaid, it does cost the state money. So it's just a matter of what committees it has to go through, and it has to go through all these steps in order to really get anywhere, and that takes years. It usually takes at a minimum like 2 or 3 years to get legislation passed. And usually that involves the money of paying a lobbyist, which is kind of sad that you have to do that, but that's part of how the system works currently. And so that's why things don't happen, or they get pushed and pushed. In North Carolina, the bill was first introduced, I want to say in like 2001, 2002, maybe 2004 at the latest. Don't quote me on the exact date, but it was early, and it took over 10 years for it to pass there.
Oh.
And I don't know, because I wasn't involved in the Georgia bill as far as insurance coverage, because I wasn't here yet, how long that one took. But it's all there. If you look at research it there, they'll let you know how long it took. But that bills will just sit there and no one doing anything with it for long periods of time, and then it gets through a committee, and then it gets either denied by a committee or just tabled by a committee, and that kind of thing. And then obviously you've got steps after that where you got through all the committees, and then you get it to the floor of the House, and then it's got to go get voted on there and approved. Then it's got to go to the Senate, and they've got to approve it. And then usually there's some arguments about that, and there's reconciliation that has to happen between the House and the Senate to agree on all the details of the bill, because sometimes they're competing bills, one for the House and one for the Senate, and then they've got to reconcile those. And then obviously the last step is it has to be signed by the governor, and then at a point, and even at that point, it's signed by the governor. It's probably going to take, depending on how it's written and how it's going to be implemented, it's going to take 6 months to a year before it's actually in place and enforced or implemented.
Okay.
So it's a long process.
Long process, getting people to come together and finding out who's here to back up the AV, whatever you're fighting for, advocating for.
Yeah, and the best advocates I've seen for it are actually for autism have been people with autism. When we went to North Carolina, sometimes we would have the parents would bring their kids and bring them to the office and then show them like, look, you think this kid needs therapy? And the kid would be doing behaviors, and then maybe the legislatures are like, get this kid out of my office, and then the parents are like, hey, you want him out of your office, pass the law. But also young adults with autism that advocate for the therapy are great, because they say, look how what this has done for me. I'm going to college. I'm going to become, I have, huge, plans for myself now because of what was done, the therapy I was able to access.
Okay.
And those advocates on that side are able to say, like, look at me, I'm proof, right? And I want the other people to have the same chance that I had. And it's sad that other kids, don't have that chance. So.
Yeah. Okay. Well, that was really good. Thank you.
No problem.
Do you have anything else to say?
I think that's it.
All right,
unless you have another question.
I don't have any more questions. You did really awesome. So I'm gonna go ahead and stop the recording.